It may also be that you have only a few of the symptoms commonly associated with depression.
It is very much the case that if you've got, say, 4 or 5 out of those symptoms that I've just listed, and they're present for most of every day for at least a couple of weeks, then that's what we would call a clinical depressive illness. And the significance of that is that that is a depressive illness that really requires treatment, both drug treatment and non-drug treatment, because we know that depression of that severity would benefit from the treatment. It's equally possible, though, for somebody to have just a couple of those symptoms and for them not to be perhaps so persistent and prominent a feature in the person's life. If that's the case, then it's worth just the person registering that as a possibility and just keeping an eye on it and seeing how it goes, so that if it does develop or any of the symptoms become more prominent or some of the other symptoms develop as well, then it's worth seeking professional guidance.
So what causes depression? What is it that makes some people more susceptible than others? Professor Priest.
The theory is that when we're depressed, something happens to the messages that are going around the brain all the time. The messages that go around the brain along the nerves in the brain usually go along as electrical impulses, but when they get to the end of one nerve and have to jump over the gap to the next nerve, a small packet of chemicals is released to bridge that gap. And what we think is happening in depression is that something has gone wrong with that chemical process, the chemical transmitter, the chemicals that transmit the message from one brain cell to the next.
Stephen held a senior job in education until a serious bout of depression brought his career to an early end.
It made me want to stop everything, to stop relating to my wife, to my children, to the work I was doing, just to stop and get away from everything. I wanted to sleep all the time. I felt to sleep and not wake up would be like paradise. It was just like a clockwork toy coming to a stop and just stopping completely, and didn't want any movement, either physical or mental, to continue. So it's like everything coming to a standstill and not wanting to do anything about it, and sensing that I couldn't do anything about it anyway. It was just there, and had been totally gripped by it.
Peter, who missed much of his schooling, has been unable to hold down a full-time job because of his depression.
I managed to take on a job when I left school. That was always an effort to get in there every day and just get through the day. In the end, it just got too much to cope with, and I had to give up work and haven't worked full-time as such for 13 years. I can just manage to do the occasional casual work on the basis of knowing that if I don't want or don't feel well enough to do it, I don't have to do it. So as long as I'm not tied to anything, I feel safe and secure. The more unwell I become, the more housebound I seem to be. So literally can't get out to meet people, to form relationships in the first place. And even when you do reach a stage where you can get out, you still find it very, very difficult to mix and approach people for the first time. Or even if they approach you, you feel very uncomfortable, subdued and withdrawn, and there's no fun. Really, just one-to-one meetings with people are about as much as you can cope with, and yet deep down you know that you do want to mix, and that there is a person there who wants to, form relationships and friendships with lots of people, but you just can't do it no matter how hard you try.
So what should you do if you feel you might be depressed? Dr. Tiley.
Well, I think the first thing to do is to go and have a chat with the GP about it, because the GP will certainly be able to assess the symptoms, and it will help the GP by going into them and saying, well, look, I've heard about depression, and I think perhaps that I've got this, and this symptom, and do you think it's possible that I might be depressed? The GP will then be able to ask a series of questions to determine, firstly, whether the person is depressed, but secondly, whether that person is depressed enough to benefit from either medication or counselling. And it's very well worthwhile going to see a GP as soon as possible. What we know is that as soon as somebody starts to receive help, there's a very good chance that they'll get better each and every week over perhaps the first 3 to 6 weeks, and that by 6 weeks they'll be feeling considerably better. If somebody has milder depression, in that perhaps they've just got 1 or 2 symptoms that indicate that they might be developing a depression, then it's very often the case that there might be a situation that will require counselling. For example, it might be the case that somebody is having a relationship problem, or perhaps they're developing financial problems. And it's very, very much the case that by talking to a third party who's not involved, that person can very often provide a sympathetic ear and a supportive ear that can perhaps, suggest solutions to problems that haven't been readily thought of. And a simple example of that might be, going to see the building society manager to get some help with paying the mortgage off, for example. Or it might be that the GP suggests that the person goes to see a relate counsellor to discuss their marital problems, for example. So it's very well worthwhile seeing a GP, even if you think that the depression is mild. And one reason for this, of course, is that it might well be the case that a more major or more severe clinical depressive illness can be prevented by that approach.
Most people with depression are treated by their family doctor. Depending on your symptoms, the severity of the depression and the circumstances, the doctor may suggest some form of talking treatment, antidepressant tablets, or even both. These tablets are not tranquilizers nor sleeping pills, and they're not addictive. They are extremely effective, as Professor Priest explains.
Depression is a very treatable illness, and so the majority of people can be helped in a matter of weeks to feel a lot better. We see, as doctors, we see people that have been depressed for 2 years, sometimes 3 years, and who get better when they're treated. And the sad thing is, of course, they've been in misery for the 2 or 3 years and haven't sought treatment before then. There's more than one way of treating depression. We're all very complex human beings, and what suits one person doesn't necessarily suit another. But in principle, there are 2 main approaches. One is the psychological approach, discussing the problems with somebody, with a professional person who's trained to help. And the other is by use of antidepressant medicines. Now, these are medicines that don't do anything for a person that's not depressed, but for a person that is depressed, they bring them back to the state they were in before they were ill in the first place. And so they're not pep pills, but they're antidepressants. They remove the depression. There's a lot of misunderstanding about antidepressants, and in fact, the sort of medicines that we're talking about are not at all habit-forming. You may have to take them for several months to avoid the risk of a relapse, but when you come to stop them again, there's no problem in stopping them. You don't get any effect of being hooked on them, and so that there are tablets that people can take in courses of several months without worrying about getting addicted.
Despite effective treatments for depression being available, there's often a marked reluctance to seek help. Why? Dr. Tiley.
There is a big reluctance, and that is largely because of the stigma that people very often feel. And we know from opinion polls that we've conducted for the Defeat Depression campaign that people do still feel that that they might get an unsympathetic hearing, and that people might feel that that they're to blame in some way for getting depressed. But the overriding message is that anybody can get depressed at any time, and in fact the lifetime likelihood of anybody getting depressed is a third. So that it's a very justifiable reason to go and see a doctor.
Vicki is 24 and has suffered from depression since she was 20. She had to give up a responsible job and is now only able to cope with temporary work. Stephen has also experienced the stigma of being identified as a depressive.
You're frightened of people knowing that, there's something wrong, thinking that you're a loony, which you're not. But that's the way a lot of people perceive depression. You're frightened of people knowing it's daft, but you are, and that's wrong. If people care about you enough, they should be able to understand, and even people that are going to employ you should be able to understand. I wouldn't tell a prospective employer that I've had depression. I'd be too frightened.
The stigma upset me a lot as I was coming out of the depression, because I realised it did cost me friends. I realised that it cost me status in the community. I'd gone from being a senior manager in education to somebody who didn't have a job and might not get a job. And I've certainly found that since. I found for 3 or 4 months I sent off lots and lots of application forms for various jobs which I knew I was highly suitable for, and that but for having to put down the application form, having had the mental illness, I could have done a job probably better than anybody else, not to even get past application form stage. There was a whole stigma attached to depression and actually putting it down on an application form. So I gave up after 3 or 4 months of writing these application forms. I thought, well, if I'm going to get a job, I'm going to be self-employed, which is what I do now.
So where does the search for help and self-help begin, and how? Dr. Tiley explains that, to begin with, just simply being able to talk through the problem is helpful.
I think that anybody who is depressed, first and foremost, needs to help themselves by feeling okay about talking to other people about it. I think a lot can be gained by feeling that it's okay to actually go and see the GP. And okay, GPs are busy people, but they can provide regular, short contacts. And that's one of the advantages of general practice, is that it's quite possible to go and see a GP for 5 to 10 minutes on a regular basis. And by doing that, it's quite possible to, conjointly with the GP or with whoever it is that you're seeing, to be able to plan a structured approach to firstly looking at problems with a view to seeing one by one which are the problems that can be sorted out. So that might mean, for example, how to discuss the problems with somebody back at home, for example, or how to arrange to go and see somebody who can help them with their problem. For example, as we said before, the building society manager, for example. Once that approach has been taken, it's also then possible to think in terms of which are the problems that aren't soluble, because there are always situations that really appear to have no solution. And if that's the case, then it's important to actually think long and hard, very often with somebody's help, as to how to learn to cope with those problems and how to learn to live with that. And very often that's quite possible simply by reframing perhaps the way that you view those particular situations. If it emerges, though, from discussion that some of the perceptions that the person has are actually unrealistic, then it might be the case that they need to spend more time looking at how they actually do perceive things. So, for example, somebody who is habitually a negative thinker, or who habitually puts themselves down, might need to actually go and test that out a bit, and to see, by keeping a diary perhaps of thoughts and feelings, how true that really is. And this is a cognitive approach that very often needs help from a professional who's trained in that approach. But it's a very easy, simple technique to actually test it out and to find out if it's really the case that perhaps that person always fails in a certain situation. Because by actually monitoring what happens, the opposite is very often the case, and it can be seen to be so when examined.